Understanding Alzheimer's disease, what you need to know. Alzheimer's disease is a progressive neurological disorder that primarily affects the elderly. It causes a gradual decline in memory, thinking skills, and the ability to carry out simple tasks, ultimately interfering with the person's daily life. Alzheimer's is the most common cause of dementia, a group of brain disorders that affect memory and behavior. While aging is a natural process, Alzheimer's is not a typical part of aging. It is a serious disease that can be caused by a combination of genetic, environmental, and lifestyle factors. The disease affects brain cells, leading to their death and the disruption of brain functions. People with Alzheimer's may struggle with memory loss, disorientation, and changes in their ability to communicate. As the disease progresses, the symptoms become more severe, and individuals may lose the ability to recognize close family members and friends. At the start of the disease, mild memory loss is often the first noticeable symptom. Over time, these symptoms worsen, making it harder for the individual to carry out everyday activities. Alzheimer's can impact not only the patient but also their loved ones, who may experience emotional and physical strain as they care for the individual. Alzheimer's disease is currently irreversible, but treatments exist that can help manage symptoms and improve the quality of life for those affected. Early diagnosis and proper care are crucial in helping to slow the progression of the disease. If you found this information helpful, please don't forget to like, comment, and subscribe to our channel for more content on Alzheimer's and other health-related topics. Your support helps us bring more valuable information to those who need it. Recognizing the early signs of Alzheimer's disease. Alzheimer's disease is a progressive condition that affects millions of people around the world, particularly older adults. The symptoms of Alzheimer's can be subtle in the early stages, often confused with normal age-related memory decline. However, there are specific signs that differentiate the disease from typical aging. Recognizing these early symptoms is crucial for diagnosis, treatment, and planning for future care. 1. Memory loss, short-term memory. One of the most common and earliest signs of Alzheimer's is noticeable memory loss, particularly short-term memory. Individuals may forget recent conversations, appointments, or events, and find it challenging to remember new information. While it's normal for everyone to forget things occasionally, Alzheimer's-related memory loss is more persistent and progressive. For example, a person might repeatedly ask the same questions or forget things they've just been told. 2. Difficulty with time and place. People with Alzheimer's often struggle with understanding the passage of time. They may lose track of dates, seasons, and the passage of time in general. For instance, they could forget which year it is or be unaware of important events that are happening. They may also become disoriented in familiar environments, getting lost in places they've visited many times before, even within their own home. This can lead to confusion and anxiety as the disease progresses. 3. Challenges with communication. As Alzheimer's affects brain cells responsible for memory and cognition, individuals may have difficulty with verbal communication. This can manifest as trouble finding the right words, repeating themselves, or losing their train of thought during a conversation. They may also struggle to follow or participate in a discussion. This can lead to frustration, as individuals may not be able to express themselves clearly or understand what others are saying. 4. Poor judgment and decision-making. Alzheimer's disease can impair an individual's ability to make sound decisions. People with early Alzheimer's may show poor judgment, like giving away large amounts of money to strangers, making unsafe decisions, or neglecting personal hygiene. These changes in judgment can be alarming to friends and family, as they may seem out of character for the individual. 5. Changes in mood and personality. Alzheimer's can cause significant mood swings and changes in personality. Individuals may become more easily upset, anxious, or depressed. They may exhibit behaviors like irritability or aggression that weren't present before. Additionally, people with Alzheimer's may become suspicious, confused, or fearful in situations that wouldn't have affected them before. This emotional instability can be difficult for both the person affected and their loved ones. 6. Difficulty with tasks and activities. As Alzheimer's progresses, individuals may have trouble completing tasks that were once familiar and routine. This could include something as simple as managing a budget, balancing a checkbook, or following a recipe. Activities like driving, managing finances, or planning social activities can become overwhelming and difficult for the person affected. Early diagnosis and seeking help. If you or a loved one notices these signs, it's important to seek medical advice early. Although there is no cure for Alzheimer's, early diagnosis can help manage symptoms and allow the person to plan for the future. Doctors may perform a variety of tests, including cognitive assessments, neurological exams, and brain imaging, to determine if Alzheimer's or another condition is present. Treatment options are available to help manage symptoms, slow the progression of the disease, and improve the individual's quality of life. Additionally, early intervention can provide time for individuals and their families to plan for long-term care and create a support system to manage the disease's challenges. Conclusion. Recognizing the early signs of Alzheimer's disease is the first step toward getting the help and support needed. If you or someone you know is exhibiting symptoms such as memory loss, confusion, or difficulty with daily activities, consider speaking with a healthcare professional. With early diagnosis and the right support, it's possible to manage the symptoms and provide better care for those affected by Alzheimer's. If you found this information helpful, don't forget to like, comment, and subscribe to our channel for more insights on Alzheimer's disease and related health topics. Your support allows us to continue bringing valuable content to you and your loved ones. Causes and risk factors of Alzheimer's disease. Alzheimer's disease is a complex condition with various factors contributing to its development. While the exact cause of the disease remains unclear, researchers believe that a combination of genetic, environmental, and lifestyle factors play a role in its onset and progression. Understanding these risk factors can help in identifying individuals at higher risk and in taking steps to mitigate potential dangers. 1. Genetics and family history. Genetics is one of the most significant factors contributing to the risk of developing Alzheimer's disease. A family history of Alzheimer's can increase an individual's likelihood of developing the condition. In particular, individuals with a first-degree relative, such as a parent or sibling, who has Alzheimer's are more likely to develop it themselves. Certain genes, such as the ApoE4 gene, have been linked to an increased risk of Alzheimer's. However, not everyone who carries this gene will develop the disease, and many people with Alzheimer's do not have a family history. This suggests that while genetics play a role, they are not the sole determining factor in the development of the disease. 2. Age. Age is the most significant risk factor for Alzheimer's. As people grow older, their risk of developing Alzheimer's increases. The majority of individuals diagnosed with Alzheimer's are over the age of 65, and the risk increases significantly after the age of 85. While Alzheimer's can affect younger individuals, known as early-onset Alzheimer's, it is far less common and often associated with genetic factors. The aging process itself causes natural changes in the brain, such as a decline in the number of brain cells and a decrease in brain plasticity. These changes may make older adults more vulnerable to developing Alzheimer's. 3. Heart health and vascular risk factors. There is growing evidence that cardiovascular health is closely linked to Alzheimer's disease. Conditions such as high blood pressure, high cholesterol, diabetes, and obesity increase the risk of Alzheimer's. These conditions affect the blood vessels in the brain, leading to reduced blood flow and oxygen supply to brain cells, which may contribute to the development of Alzheimer's. Moreover, the accumulation of plaque in the arteries, known as atherosclerosis, can also restrict blood flow, further increasing the risk of cognitive decline and Alzheimer's. People who are proactive about managing these conditions through lifestyle changes and medication may reduce their risk of developing Alzheimer's. 4. Lifestyle factors. Several lifestyle factors can influence the development of Alzheimer's. A sedentary lifestyle, poor diet, and lack of mental stimulation are all associated with an increased risk. On the other hand, maintaining a healthy lifestyle by staying physically active, eating a balanced diet rich in antioxidants and healthy fats, and keeping the brain engaged through activities like reading, puzzles, or learning new skills can help lower the risk. Social engagement and maintaining strong social connections have also been linked to a reduced risk of Alzheimer's. Isolation and lack of social interaction can negatively impact cognitive health, while being actively involved in social and community activities helps stimulate the brain. 5. Traumatic brain injury, TBI. Another significant risk factor for Alzheimer's is a history of traumatic brain injury, such as a concussion or a blow to the head. People who have experienced severe or repeated head injuries are at a higher risk of developing Alzheimer's later in life. This is particularly true for individuals who have suffered multiple concussions or long-term brain trauma, which may accelerate the accumulation of plaque in the brain that is characteristic of Alzheimer's disease. Conclusion. While Alzheimer's disease is influenced by a variety of factors, there is no single cause. Genetics, age, cardiovascular health, lifestyle, and traumatic brain injury all play a role in determining an individual's risk. Understanding these risk factors is crucial for prevention and early intervention. Although we cannot control all of these factors, making healthy choices, staying active, and monitoring cardiovascular health can significantly reduce the risk of developing Alzheimer's. Diagnosing Alzheimer's disease. Diagnosing Alzheimer's disease can be challenging, especially in the early stages when symptoms may resemble normal aging or other health conditions. However, early diagnosis is critical for managing the disease, as it allows individuals and their families to plan for the future, explore treatment options, and make lifestyle adjustments. Medical professionals use a combination of assessments, tests, and patient history to diagnose Alzheimer's. 1. Medical history and symptom review. The first step in diagnosing Alzheimer's is a thorough medical history. The doctor will ask about the patient's symptoms, including memory loss, confusion, and difficulty with daily tasks. They will also inquire about any family history of Alzheimer's or other dementias, as genetics can play a role in the disease's onset. In some cases, a caregiver or family member's perspective on the individual's behavior changes may also provide crucial information for diagnosis. 2. Cognitive and neuropsychological tests. Doctors typically perform a variety of cognitive and neuropsychological tests to assess the individual's memory, attention, language skills, problem-solving abilities, and other cognitive functions. These tests help determine the extent of cognitive decline and whether it is consistent with Alzheimer's or another form of dementia. For example, the Mini-Mental State Examination, MMSE, or the Montreal Cognitive Assessment, MoCA, are commonly used tools to evaluate cognitive function. 3. Brain imaging. Imaging tests, such as CT, computed tomography, scans or MRI, magnetic resonance imaging, scans, may be used to rule out other potential causes of dementia, such as brain tumors, strokes, or other conditions. In some cases, doctors may use specialized imaging techniques like positron emission tomography, PET, scans, which can detect abnormal amyloid plaques in the brain, one of the key hallmarks of Alzheimer's disease. 4. Laboratory tests. Blood tests may be conducted to rule out other conditions that might mimic Alzheimer's symptoms, such as thyroid disorders, vitamin deficiencies, or infections. While blood tests cannot directly diagnose Alzheimer's, they help eliminate other potential causes for cognitive decline. Conclusion. An accurate diagnosis of Alzheimer's requires a comprehensive evaluation, combining medical history, cognitive assessments, brain imaging, and lab tests. Although there is no single definitive test for Alzheimer's, early diagnosis is important for managing the disease and improving the quality of life for both patients and caregivers. Treatment options for Alzheimer's disease. Currently, there is no cure for Alzheimer's disease, but several treatment options can help manage symptoms, slow the progression of the disease, and improve the quality of life for individuals affected by it. These treatments focus on alleviating cognitive symptoms, managing behavioral changes, and providing support for both patients and caregivers. 1. Medications for cognitive symptoms. There are several FDA-approved medications used to treat the cognitive symptoms of Alzheimer's, primarily aimed at increasing the levels of acetylcholine in the brain. Acetylcholine is a neurotransmitter involved in memory and learning, and its levels are often reduced in Alzheimer's patients. The most commonly prescribed medications are donepezil, Aricept, used to treat mild to moderate Alzheimer's. It works by increasing acetylcholine levels, helping to improve memory and cognition. Rivastigmine, Exelon, available in both pill and patch forms. It is used to treat mild to moderate Alzheimer's by inhibiting the breakdown of acetylcholine. Galantamine, Razidine. This medication also works by increasing acetylcholine levels and is typically used in the early stages of Alzheimer's. While these medications can help manage symptoms, they do not stop or reverse the progression of the disease. They may, however, temporarily slow cognitive decline and improve daily functioning. 2. Medications for behavioral symptoms. In addition to cognitive medications, there are drugs available to help manage the behavioral and psychiatric symptoms of Alzheimer's, such as anxiety, depression, agitation, and aggression. These medications include antidepressants, selective serotonin reuptake inhibitors, SSRIs, like sertraline, Zoloft, can be used to treat depression and anxiety. Antipsychotics, drugs like risperidone, Risperdal, may be used for agitation or aggression, but they are generally used with caution due to potential side effects. Mood stabilizers, medications like valproate, Depakote, may be prescribed for severe mood swings or aggression. 3. Non-pharmacological treatments. In addition to medication, non-drug interventions are crucial in managing Alzheimer's. These may include cognitive therapy and brain training exercises. Activities like puzzles, memory games, and word exercises can help stimulate the brain and slow cognitive decline. Behavioral therapies, strategies aimed at managing problem behaviors, such as aggression or wandering, through environmental modifications, routine establishment, and caregiver training. Physical exercise, regular physical activity has been shown to improve cognitive function and overall well-being, reducing anxiety and depression. Music therapy and reminiscence therapy. These therapies involve using familiar songs or revisiting memories to promote emotional and cognitive engagement. Conclusion. While Alzheimer's disease is progressive and incurable, a combination of medications and non-pharmacological treatments can significantly improve the quality of life for those affected. Early diagnosis and a tailored treatment plan can help manage symptoms, slow the disease's progression, and offer support for patients and their families. It is important to work closely with healthcare professionals to create a comprehensive approach to care. Preventing Alzheimer's disease, lifestyle and health factors. While there is no guaranteed way to prevent Alzheimer's disease, research suggests that certain lifestyle choices and health management strategies can help reduce the risk or delay the onset of cognitive decline. A healthy brain is influenced by a variety of factors, including physical health, mental stimulation, and social engagement. 1. Physical exercise. Regular physical activity is one of the most effective ways to promote brain health. Exercise increases blood flow to the brain, which helps nourish brain cells and may reduce the risk of developing Alzheimer's. Studies suggest that aerobic exercise, such as walking, cycling, and swimming, can improve memory, cognitive function, and even slow the progression of Alzheimer's in its early stages. Exercise also has benefits for overall health, such as improving cardiovascular health, which in turn supports brain function. 2. Healthy diet. Eating a balanced diet rich in nutrients is essential for brain health. Diets that are high in antioxidants, healthy fats, and essential vitamins can help protect the brain from oxidative stress and inflammation, both of which are believed to contribute to Alzheimer's disease. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, fish, and healthy fats like olive oil, has been linked to a reduced risk of dementia. Foods rich in omega-3 fatty acids, such as salmon and walnuts, are particularly beneficial for brain health. Additionally, reducing the intake of processed foods, refined sugars, and unhealthy fats may help reduce inflammation and lower the risk of Alzheimer's. 3. Mental stimulation. Keeping the brain active is important for maintaining cognitive function. Engaging in activities that challenge the mind, such as reading, learning a new skill, doing puzzles, or playing strategy games, can help build cognitive reserve. Cognitive reserve refers to the brain's ability to compensate for damage by using existing networks of neurons. Studies show that individuals who stay mentally active throughout their lives are less likely to develop Alzheimer's or other forms of dementia. 4. Social engagement. Staying socially active is another key factor in reducing Alzheimer's risk. Engaging in regular social interactions helps stimulate cognitive function and emotional well-being. Loneliness and social isolation have been linked to a higher risk of cognitive decline, while maintaining strong social connections can help improve mental health and reduce stress. Whether through spending time with family, participating in community activities, or joining social groups, staying socially engaged can be beneficial for both mental and physical health. 5. Managing chronic conditions. Managing chronic health conditions, such as diabetes, high blood pressure, and high cholesterol, is also crucial for reducing the risk of Alzheimer's. These conditions can negatively affect brain health by reducing blood flow to the brain or increasing inflammation. Regular checkups and adherence to prescribed treatments for these conditions can help protect cognitive function over time. Conclusion. While there is no surefire way to prevent Alzheimer's disease, adopting a healthy lifestyle that includes regular exercise, a balanced diet, mental stimulation, social engagement, and effective management of chronic conditions can significantly reduce the risk of developing the disease. Early lifestyle interventions are key to maintaining brain health and improving overall well-being. Support for caregivers of Alzheimer's patients. Caring for someone with Alzheimer's disease can be both emotionally and physically exhausting. As the disease progresses, individuals with Alzheimer's may require increasing levels of care, which can put a significant strain on family members and caregivers. Providing proper support for caregivers is crucial for ensuring both the well-being of the patient and the caregivers themselves. 1. Understanding the role of the caregiver. Caregivers of individuals with Alzheimer's disease often take on multiple roles, from providing physical assistance with daily tasks to offering emotional support. This can include managing medications, helping with personal hygiene, preparing meals, and assisting with mobility. As the disease progresses, caregivers may also need to manage behavioral changes, such as aggression, confusion, and wandering. The role can be overwhelming, and it's important for caregivers to recognize their own limitations and seek help when needed. 2. Respite care. Respite care services provide temporary relief for primary caregivers. These services allow caregivers to take a break and focus on their own health and well-being. Respite care can be provided in various forms, including in-home help from a trained caregiver, adult daycare programs, or short-term stays in nursing homes or assisted living facilities. Taking time for oneself is essential to prevent burnout and maintain the caregiver's mental and physical health. 3. Support groups. Alzheimer's caregivers often feel isolated due to the demands of caregiving. Joining a support group can provide emotional support and help caregivers connect with others who are facing similar challenges. Support groups offer a safe space to share experiences, advice, and coping strategies. Many organizations, such as the Alzheimer's Association, offer both in-person and online support groups, providing flexibility for caregivers. 4. Education and training. Educating caregivers about Alzheimer's disease and effective caregiving strategies is essential. Understanding the progression of the disease, common behavioral changes, and communication techniques can help caregivers manage difficult situations with more confidence and compassion. Training programs and resources can teach caregivers practical skills, such as how to assist with daily tasks, manage medication, and deal with challenging behaviors. 5. Emotional and psychological support. Alzheimer's caregivers often experience feelings of grief, stress, and anxiety, especially as they watch their loved one's condition worsen. It's important for caregivers to seek emotional and psychological support to cope with the emotional toll. Therapy, counseling, and talking to trusted friends and family members can help caregivers process their emotions. Recognizing and addressing their own emotional needs is vital for maintaining a healthy caregiving relationship. Conclusion. Caring for someone with Alzheimer's disease is a challenging journey, and caregivers need support to manage the physical, emotional, and psychological demands of the role. Accessing respite care, participating in support groups, receiving education, and seeking emotional support are all essential for ensuring the well-being of caregivers. Providing proper support helps caregivers sustain their own health and improves the quality of care for the person with Alzheimer's. The impact of Alzheimer's on families and relationships. Alzheimer's disease not only affects the individual diagnosed but also has a profound impact on their family members and relationships. As the disease progresses, family dynamics can change dramatically, leading to emotional, social, and financial challenges. Understanding these impacts and preparing for them is essential for both the person with Alzheimer's and their loved ones. 1. Emotional strain. The gradual decline of a loved one's cognitive abilities can be deeply emotional for family members. Witnessing memory loss, confusion, and personality changes can lead to feelings of grief, sadness, and helplessness. Family members may struggle with the emotional toll of caregiving as they watch the person they love slowly lose their independence. 2. Role changes. As Alzheimer's progresses, family members may take on caregiving roles that were previously filled by the individual. This role reversal can cause tension, especially if the person with Alzheimer's had previously been a caregiver or held a significant role in the family. It may also place a strain on relationships as family members adjust to new responsibilities. 3. Social isolation. Families may experience social isolation due to the demands of caregiving. Attending social events or maintaining previous friendships may become difficult, and caregivers often find themselves withdrawing from social activities. This can lead to loneliness and feelings of isolation, both for the person with Alzheimer's and their family members. End-of-life care and considerations for Alzheimer's patients. As Alzheimer's disease progresses to its final stages, patients and their families must confront end-of-life care decisions. The disease's irreversible nature means that patients will eventually lose the ability to communicate, recognize loved ones, or care for themselves. This period can be emotionally overwhelming for families, making careful planning and open discussions about end-of-life care essential. 1. Palliative care. Palliative care focuses on providing comfort and improving the quality of life for individuals with serious illnesses, including Alzheimer's. Unlike curative treatments, palliative care aims to manage symptoms such as pain, anxiety, and difficulty swallowing, helping the patient feel as comfortable as possible. This type of care often involves a team of healthcare professionals, including doctors, nurses, social workers, and counselors. 2. Hospice care. Hospice care is a specialized form of palliative care designed for individuals in the final months of life. It emphasizes comfort, dignity, and support for both the patient and their family. Hospice care can take place at home, in a hospice facility, or in a hospital setting, with a focus on easing physical and emotional suffering. 3. Advanced directives and legal planning. Planning ahead with advanced directives, such as a living will or healthcare proxy, is critical. These documents allow individuals to express their preferences for medical care if they become unable to communicate their wishes. Discussing these choices with family members and healthcare providers helps ensure that the patient's end-of-life care aligns with their values. Conclusion. End-of-life care for Alzheimer's patients requires thoughtful planning, support, and compassionate care to ensure comfort and dignity during the final stages of the disease. Alzheimer's disease research and future directions. Ongoing research into Alzheimer's disease is crucial for understanding its causes, developing better treatments, and ultimately finding a cure. Scientists are exploring various avenues, from genetics to lifestyle interventions, to address the complexities of this devastating condition. As research progresses, new insights into the disease could lead to more effective therapies and improved care strategies. 1. Genetic research and biomarkers. One area of active research is the identification of genetic factors and biomarkers that could help in the early detection of Alzheimer's. The discovery of specific genes associated with the disease, such as the ApoE4 gene, has already provided valuable insights. Researchers are also studying biomarkers in blood and cerebrospinal fluid that could predict the onset of Alzheimer's years before symptoms appear. 2. Drug development and clinical trials. Clinical trials are exploring new drugs that target the underlying causes of Alzheimer's, such as amyloid plaques and tau tangles in the brain. New treatments aim to slow or stop the progression of the disease. Several promising drugs are currently in trial phases, and breakthrough therapies could offer hope in the near future. 3. Lifestyle and preventative research. Researchers are also studying the role of lifestyle factors, such as diet, exercise, and cognitive stimulation, in preventing or delaying Alzheimer's. These findings could help develop strategies to reduce the risk of the disease. As Alzheimer's research continues, hope for better treatments and prevention methods grows. Stay informed and continue supporting this critical research. If you found this information helpful, don't forget to like, comment, and subscribe for more updates on Alzheimer's disease and other health topics.